Hi, this is Kim Streit from the Florida Hospital Association, and I want to talk to you about an urgent issue that is facing the state of Florida. Overdoses are the leading cause of death for pregnant women and women within 1 year of having a baby. Most of these deaths occur after the baby is born and the mother has been discharged from the hospital. Maternal mortality due to overdoses is such a pressing issue that the Florida Department of Health issued an urgent message to providers and hospitals recommending steps to take to reduce the chances of women dying from an overdose. This problem can be prevented. Narcan, naloxone, is an approved medication for the treatment of overdoses and saves lives. It is safe and easy to use, and it is available from the state of Florida through the DCF Overdose Prevention Project, which provides Narcan kits to hospital emergency departments for free. These free Narcan kits can be used in your maternity unit to provide to new mothers with opioid use disorder before they leave the hospital. While some standing orders might include writing a prescription for naloxone, the chances of a new mom or a family member picking up that prescription are slim. That is why this program, where the Narcan kits are provided before the mom leaves the hospitals, can be life-saving.
Well, I'm Carol Lawrence from Lee Health, and I just wanted to share our Narcan program that we've implemented for our OB patients at Lee Health at two of our hospitals, Cape Coral Hospital and Health Park Medical Center. We met with our pharmacists, our FPQC MORE team, our nurses, met with our pharmacists, and we developed the goal for the project is we wanted our OB patients, whether they were delivered or undelivered, to be able to get free Narcan. And we wanted to remove any of the financial barriers and structural barriers. We early on knew that we couldn't wait until a discharge workflow because, as you know, sometimes these ladies leave suddenly and unexpectedly. So that was our goal. We've had to try a few things, but I'm going to share with you what our final product is. The first thing we had to do was talk to our emergency room and our sister hospitals because we had heard about the DCF Overdose Prevention Program that provided free Narcan. And when we reached out to our pharmacists in our emergency room, we realized that we were already participating in that program. So that's a really good first step. Another critical step that we did is we went to our members of the Department of OBGYN, our physician and midwife colleagues, and we obtained permission for a standing order to give Narcan, and we developed a very simple criteria. If they were pregnant, if they were within, if any substance use within 9 months of their delivery, or if they're within 6 weeks postpartum, and they admit to any opioid use, or they're on medication-assisted therapy, we wanted those women to be able to get the Narcan, and we wanted the nurses to be able to do it without having to get an additional order. So we got approval for that standing order. Then we worked with our inpatient pharmacist to get the Narcan stocked in our Pyxis, our medication dispensing machines. That was a bit of a barrier struggle because in the ED, it was kind of owned by them and our outpatient pharmacy, but we got cooperation and our inpatient pharmacy team assumed the free Narcan doses and are now putting it in our medication dispensing machines on our OB units. The electronic health record workflow is that when the nurse places that order, it puts a medication on the electronic MAR, medication administration record. So they see that it's there, they know to pull the kit out of the Pyxis, it's documented that they gave it to them. So in summary, what our workflow is the nurse has the authority to place the order. They place the order. They go then to the medication dispensing machine and the Pyxis. They pull the kit out. The kit is prepackaged with a label and with the patient education materials. She takes it to the room. She gives it to the patient. As soon as that use is identified, it might be within a few hours of admission or a few minutes after they come to the OBED or our triage areas. They do that teaching and they document it on the MAR. So everybody knows that the woman received the medication and the teaching. And that makes it easy also for data extraction to know that the woman actually did receive the Narcan. So I encourage you all to work with your pharmacists and your nursing teams to develop a workflow that removes a lot of the financial and structural barriers to getting Narcan in the hands of women that need it.